Look down at your feet right now. Go ahead, I'll wait. Do you see swelling that wasn't there 6 months ago? Maybe a yellowish tinge creeping across your toenails? Or tiny red spider-like lines just above your ankles? Most people blame aging. Most people blame standing too long or eating too much salt. But here's what most people don't know. Your feet are one of the earliest messengers your liver sends when something is going terribly wrong inside your body. And by the time you notice these signs, your liver may have already been struggling for months, sometimes years, in complete silence. Welcome back, everyone. Today we're talking about something that could genuinely change the course of your health: the connection between the appearance of your feet and the condition of your liver. Now, why does this matter so much for those of us over 60? Because fatty liver disease and early-stage cirrhosis are reaching epidemic levels in older adults across the United States. The American Liver Foundation estimates that nearly 100 million Americans have some form of fatty liver disease, and the majority of them have absolutely no idea. They've never been diagnosed, they've never been tested, and the reason is simple. The liver doesn't have pain receptors in the same way your knee or your back does. It suffers quietly. It deteriorates without screaming for help. But it does whisper, and one of the places it whispers loudest is your feet. So today, I'm going to walk you through the specific changes in your feet that may indicate your liver is under serious stress. We'll cover what to look for, why it happens, what you can do about it starting tonight, and when you absolutely must see a doctor. Stay with me through this entire video because the last sign I'll share is one that almost nobody talks about, and it could be the difference between catching liver disease early and catching it far too late. Let's start with the most common sign: swelling in your feet and ankles that seems to appear out of nowhere or gradually worsen over weeks and months. Now, I know what you're thinking. Swollen feet? That's just what happens when you get older. You stand too long at the grocery store, you sit on a long car ride, gravity does its thing. And yes, mild occasional swelling can be perfectly normal. But here's the distinction. When your liver is struggling, particularly when fatty liver has progressed to inflammation or early fibrosis, it starts producing less of a protein called albumin. Think of albumin as the sponge inside your blood vessels that keeps fluid where it belongs. When albumin drops, fluid leaks out of your blood vessels and pools in the lowest parts of your body: your feet, your ankles, sometimes your shins. This kind of swelling feels different. Press your thumb into the swollen area for about 5 seconds and then release. If an indent stays, a little pit that takes several seconds to fill back in, that's called pitting edema, and it's a red flag worth investigating. Many seniors notice their shoes feeling tighter in the evening, or sock lines that dig deeper than they used to. They buy wider shoes, they elevate their feet, but they never connect that persistent puffiness to their liver. If you're experiencing swelling that doesn't fully resolve overnight, that appears in both feet symmetrically, and that's been worsening gradually, please mention it to your doctor and specifically ask about liver function. Here's one that surprises almost everyone. Take a look at the soles of your feet. Are they unusually red, particularly around the ball of the foot and the heel? Does the redness blanch, meaning it turns white when you press on it, and then flood back to red when you release? Most people have heard of palmar erythema, which is redness on the palms of your hands associated with liver disease. But very few people know that the exact same phenomenon occurs on the soles of your feet. It's called plantar erythema, and it happens because a struggling liver cannot properly metabolize certain hormones, particularly estrogen. Excess estrogen causes small blood vessels near the skin's surface to dilate permanently, creating that flushed, warm, rosy appearance. This isn't the same as your feet being red after a hot bath or after walking barefoot on rough carpet. This redness is persistent. It's there in the morning when you wake up. It's there when your feet are elevated. It doesn't go away with rest. If you've noticed this and dismissed it as poor circulation or just the way your skin looks now, consider that your liver might be sending you a very specific message. You've probably seen spider veins before. Those tiny networks of red or purple lines that branch out like little tree roots just beneath the skin. On the legs and ankles, most people assume they're a cosmetic issue, a vein problem, something to cover up with socks and forget about. But spider angiomas, which look slightly different from ordinary spider veins, are strongly associated with liver dysfunction. A spider angioma has a central red dot with thin vessels radiating outward, like the legs of a spider. If you press on that central dot and the surrounding lines disappear, then reappear when you release, that's a classic spider angioma. When these appear in clusters around your ankles, lower calves, or the tops of your feet, especially if you're developing new ones that weren't there a year ago, your liver's inability to clear excess estrogen from the bloodstream may be the underlying cause. 1 or 2 spider veins anywhere on the body, completely normal at any age, 5, 10, 15 of them appearing in a short period? That deserves a conversation with your physician and a liver panel blood test. Have you been dealing with itching on your feet, especially the tops of your feet or your ankles, that no cream, no moisturizer, no antihistamine seems to fully resolve? The kind of itch that wakes you up at night or drives you slightly mad during the day? This is one of the most underrecognized symptoms of liver trouble in older adults. When your liver is struggling to process bile properly, bile salts can accumulate in your bloodstream and deposit in your skin. These bile salts are intensely irritating to nerve endings. The itch they produce is deep, relentless, and maddening, and it often starts in the extremities, particularly the feet and hands. Doctors call this cholestatic pruritus. You don't need to remember that term. What you need to remember is this: if you've been itching for weeks or months, if your skin looks relatively normal despite the itching, no obvious rash, no fungal infection, no dry flaking that would explain it, and if moisturizers and hydrocortisone aren't helping, ask your doctor to check your liver enzymes and your bile acid levels. Many seniors suffer with this itch for a long time before anyone thinks to look at the liver. Don't let that be you. If you're over 60 or caring for an elderly loved one, this information could genuinely be life-saving. Fatty liver disease caught early, before significant scarring occurs, is often reversible with lifestyle changes alone. No medication required, no surgery, just early detection and the right adjustments. So if any of what I've described sounds familiar, please keep watching because we still have several important signs to cover, and I'll share exactly what steps to take at the end. If this video is helping you, tap that subscribe button right now so you never miss these health updates, and drop a comment below. Tell me, have you noticed any changes in your feet that you've been wondering about? I read every single comment. Take a close look at your toenails, not just the surface. Look at the nail bed underneath. Is there a yellowish discoloration that doesn't seem related to fungus? Are your nails becoming unusually white at the base, with a darker band near the tip? There are specific nail changes associated with liver disease that differ from ordinary fungal infections or aging nails. Terry's nails, where most of the nail appears white or pale with a narrow dark band at the tip, are seen frequently in people with cirrhosis. Lindsay's nails, where the bottom half is white and the top half is brown or reddish, can also indicate liver or kidney dysfunction. Yellow nails from liver trouble tend to have a uniform, even discoloration rather than the patchy, crumbly, thickened appearance of fungal nails. The yellow comes from bilirubin, a pigment your liver is supposed to process and excrete. When the liver falters, bilirubin accumulates in tissues, including your nail beds. If your toenails have changed color gradually over the past several months and antifungal treatments haven't helped, the cause might not be in your feet at all. The cause might be 3 feet higher, tucked behind your right rib cage. Your liver. This one catches people off guard. Numbness or tingling in your feet, that pins and needles feeling, or a burning sensation along the soles is most commonly attributed to diabetic neuropathy or poor circulation, and those are valid causes. But advanced liver disease can produce neuropathy of its own. When your liver is severely compromised, it struggles to store and release B vitamins properly, particularly B12 and thiamine. Deficiencies in these vitamins directly damage the protective coating around your nerves, called the myelin sheath. The longest nerves in your body, the ones running all the way down to your toes, are affected first. Additionally, toxins that a healthy liver would filter out begin accumulating in the bloodstream when liver function declines. These circulating toxins can irritate and damage peripheral nerves directly. So if you've been told your tingling feet are just neuropathy but nobody has checked your liver function thoroughly, or if you have known fatty liver disease and are developing new neurological symptoms in your feet, those two things may be deeply connected. I want to address this one carefully because it's sensitive, but it's medically significant. A distinctive musty, slightly sweet, almost chemical odor coming from your feet or your body generally that soap and hygiene don't eliminate can be a sign of hepatic dysfunction. Doctors sometimes call this fetor hepaticus when it presents on the breath, but the same metabolic byproducts, particularly dimethyl sulfide, can be excreted through sweat glands, including on your feet. It smells faintly like garlic mixed with something decaying, or like overripe fruit with a sulfurous edge. This isn't the smell of ordinary foot sweat, it's distinct enough that family members sometimes notice it before the person themselves. If someone close to you has mentioned an unusual odor and you can't identify its source despite good hygiene, that's worth mentioning at your next medical appointment. Your liver produces clotting factors and proteins essential for wound repair. When liver function declines, even small cuts, cracks, or blisters on your feet may take significantly longer to heal than they once did. Many seniors develop dry, cracked heels that never seem to fully close up. They develop small nicks from trimming toenails that bleed more than expected and scab over slowly. They bruise along the tops of their feet from minor bumps, and those bruises linger for weeks, turning strange colors as they fade. Slow healing plus easy bruising on the feet and lower legs is a combination that should prompt liver function testing, especially if you're not diabetic and don't have another obvious explanation. Alright, so you've heard the signs. Maybe one or two resonated with you. Maybe several did. Here's what I want you to do with this information. First, do not panic. Fatty liver disease is extremely common, and in its early stages, it is manageable and often reversible. The goal here is awareness, not fear. Second, schedule a simple blood test. Ask your doctor for a comprehensive metabolic panel that includes AST, ALT, GGT, albumin, and bilirubin. These markers together paint a picture of how your liver is functioning right now. If anything comes back elevated, your doctor may order an ultrasound or a fibroscan, which measures liver stiffness and can detect scarring without any needles or surgery. Third, start making changes today that your liver will thank you for within weeks. Reduce sugar intake, particularly fructose from sweetened beverages and processed foods. Excess fructose is metabolized almost exclusively by the liver and is a primary driver of fatty liver disease. Incorporate movement every single day. 30 minutes of walking reduces liver fat more effectively than many medications. Your liver responds to physical activity remarkably fast. Studies show measurable improvements in liver enzymes within 2 to 4 weeks of regular moderate exercise. Limit alcohol or eliminate it entirely if you already have fatty liver. Even moderate drinking accelerates liver damage when the organ is already compromised. Add liver-supportive foods to your plate: leafy greens, cruciferous vegetables like broccoli and Brussels sprouts, fatty fish rich in omega-3s, coffee in moderation. Yes, coffee has shown consistent liver protective benefits in large studies, and foods rich in vitamin E like almonds and sunflower seeds. Stay hydrated. Your liver needs adequate water to perform its 500+ daily functions, including filtering your blood and producing bile. Fourth, examine your feet once a week. Sunday evenings, before bed, sit down and really look at them. Note any changes. Take photos with your phone if something looks different. This gives you, and your doctor, a timeline if something develops. Let me bring this all together. Your feet are not just what carry you through the day, they're a diagnostic canvas. Swelling that leaves pits when pressed, redness on the soles that doesn't fade, spider-like vessels multiplying near your ankles, relentless itching with no visible cause, nail discoloration that antifungals won't touch, numbness and burning creeping in, unusual odor despite good hygiene, wounds and cracks that refuse to heal properly. Any one of these alone might mean nothing, but 2 or 3 together, especially in someone over 60, especially in someone who carries extra weight around the midsection or has a history of high triglycerides or type 2 diabetes, that pattern deserves investigation. Your liver has been working for you every single day of your life without complaint. It filters over a liter of blood every minute. It produces bile, stores vitamins, builds proteins, neutralizes toxins, regulates cholesterol. It is among the most forgiving organs in your entire body, capable of regenerating even after significant damage if you catch the problem in time. The key phrase there is in time. So look at your feet tonight. Really look. And if something doesn't seem right, make that appointment. Tell your doctor what you noticed, ask for the blood work, advocate for yourself because nobody knows your body better than you do. If this video opened your eyes to something you hadn't considered before, please share it with a family member or friend who might need to hear it too. Sometimes the people we love won't look things up for themselves, but they'll watch a video we send them. Subscribe to this channel if you haven't already. We publish senior health content every single week, designed to keep you informed, empowered, and ahead of problems rather than reacting to them after the damage is done. And leave me a comment below. I want to hear from you. Have you noticed any of these signs in your own feet? Have you had your liver checked recently? Your story might be the one that encourages someone else to take action. Take good care of yourselves. I'll see you in the next one.